I'm Melissa Ponzio, and this is WebMD's Ask the Pharmacist. With McCary Weck-Marciniak, National Spokesperson for the American Pharmacist Association, Clinical Associate Professor at the UNC Eshelman School of Pharmacy, and practicing pharmacist. She's here to answer the most frequently asked pharmaceutical questions put to us by you, the WebMD community. Today, we're talking about women's health with a focus on everything from trying to conceive to birth control, menopausal symptoms, and supplements. So let's get started. I recently found my prescription pills for hot flashes, and I really could use them. They expired June of 2009. Can I still take them?
Unfortunately, in this case, I would say it's not a good idea for this woman to use the prescription that she has on hand. When a medication is past its expiration date, it's hard for us to assure that it's as potent or effective as it once was. So I couldn't assure her that these medications would even work for her. So in this case, I would encourage her to go back to her primary care provider and talk with her about what's going on to see if that's the right medication or if something else would be appropriate.
Are there any over-the-counter medications to increase fertility?
There aren't any medications available over the counter that could help someone with their fertility. The only medications that we have are available by prescription.
Is there any medication to help a woman have an orgasm?
So there are some studies underway that are looking at use of these medications for women to help them achieve an orgasm. But as of now, nothing has been FDA approved. But it may be something that comes up in the future. So I'd encourage women to kind of talk with their providers about these kinds of issues.
How soon after commencing the use of Macrobid should one experience a decline in the symptoms of cystitis? I've taken it for slightly over 24 hours and no change as of yet. Am I being impatient?
Well, cystitis is another name for a urinary tract infection, and Macrobid is an antibiotic that we can use to help treat that infection. Now, generally, when you start taking an antibiotic, it'll start working fairly quickly, but I would say it would be a day or maybe two when they would really start to feel better. So she may be being slightly impatient at this point, but I would give it another day and see if she's feeling any better at that point. But if she's not feeling better 2 or even 3 days in, I would definitely encourage her to call her primary care provider. It's very possible that we need to use a different antibiotic to treat this infection, or that there may be something else going on. So I would say hold out just a little bit longer and see if those symptoms resolve. And if not, then definitely talk to a primary care provider.
Is there a generic medicine for women with bladder control issues?
Well, bladder control problems, or often called incontinence issues, can happen with women, and there are a number of medications available by prescription that are generic that can help to be used to treat those symptoms. So there are definitely a number of options that this woman could talk with her healthcare provider about.
I'm 56 years old and have just finished a 5-year regimen of tamoxifen. Are there any side effects I should expect from going off of it?
Well, number one, I'd like to congratulate this person for making it all the way through breast cancer treatment and doing so well that now they can discontinue the tamoxifen. That's a really huge step. And there's not really any problems once she goes off of that medication. The one thing her provider may continue to look for is her bone density. Sometimes when women are on tamoxifen, their bones are protected for a little while, and maybe once that medication stopped, her bone density may start to decline. And this is common even as women age, and particularly once they're postmenopausal. So maybe bone density would be something she might want to check, but that's really important for all women, not just those who are discontinuing tamoxifen.
Okay. Have fish oil supplements been purified? That is, have the heavy metals been removed? Can they be removed? I'm particularly concerned about mercury.
Well, this can be a difficult question. Overall, I think it's important to know a little bit about dietary supplements. What's good to know is that dietary supplements aren't actually regulated by the FDA like other products available over the counter might be, like non-prescription medications. And so as such, we really don't have someone out there testing them all the time to be sure that they're safe, that they're effective, and that they don't have other types of contaminants in them. But generally speaking, most processes will not have a system by which the fish oil supplements would contain mercury, so it would be generally safe. And I would encourage this person, if they're particularly concerned about a contaminant like this, to look for a dietary supplement that has the USP symbol on it. It means that the United States Pharmacopoeia, or USP, has looked at this product and verified that the manufacturer goes through appropriate practices so that their products are always prepared according to appropriate standards.
Great.
That would be the best way to check to make sure that that product is probably safe.
I get nauseous whenever I take a calcium supplement. It doesn't matter what type, chewables, swallowed tablets, etc. I still get very sick to my stomach. Any ideas why and what I can do?
Well, there's a couple different types of calcium supplements available over the counter. The most common one is called calcium carbonate. So what I could encourage her to do is to try to take that calcium with some food. Calcium carbonate supplements are best taken with food. Your body needs some stomach acid in order to break down that product. I would try maybe starting with at least one tablet and taking it with food. And if you can handle that, then maybe we can work to increasing so you can take more tablets as you need throughout the day.
Do one-a-day women's 50-plus Advantage vitamins have enough B-complex for a 69-year-old lady?
Well, I think when choosing a multivitamin, it is nice to pick one that fits for your particular conditions. And there are a number of multivitamins available that are specifically tailored to the needs of seniors or older adults. And these, the product that she's mentioning would have plenty of vitamin B or B complex that would be suitable for an older adult. In fact, most multivitamins do have sufficient amounts of vitamin B for anyone.
Okay, here's a real question for you. So when you go into the vitamin aisle nowadays, you see all those vitamins that are, generated for, seniors, for a healthy heart, for people that, exercise. You see all that. Is that marketing, or is that really like the vitamin that I should be picking?
I think, honestly, it's probably a little bit of both. That there are some products there that are better for some people to take, and some that are sort of marketing and trying to educate people about some product that may be beneficial for them. I'd say in the case of seniors, most of the senior type of multivitamins, the ones that are geared to those 50 and older, do have more amounts of some key vitamins and minerals, particularly things like calcium or vitamin D, and so that is very important. Some of the other products that are conferred for things like heart health or maybe losing weight may or may not have supplements that have proven to be safe and effective for that use. But I would say in general, if a senior was looking to buy a vitamin, that they should go with some of those that are for the more mature adults.
Is it safe to take St. John's wort or black cohosh for hot flashes and mood swings?
So there are two separate products here with two sort of separate indications. St. John's wort is a dietary supplement, and it's used to elevate mood, and that may be what the person's referring to by some mood swings. They have actually done some studies, and it's proven to be somewhat good for sort of more mild symptoms of depression, but generally speaking, it is an okay option to take. The big thing, though, with St. John's wort is that it has a number of drug interactions. There are a number of prescription products that it can interact with.
Really?
And so I would definitely want to make sure that this woman checked with a healthcare provider first. Talk to your pharmacist and see if some of the medications you may be taking might have a severe interaction with the St. John's wort. For the black cohosh, there is some evidence that it can help also with hot flashes, night sweats that may be occurring. And so that could be an option for her as well. But again, I would want to see if there's any other medications you're taking, particularly some estrogen kind of containing products, because they can have a similar effect. So both could be separate options for those separate indications. St. John's wort maybe for mood, or the black cohosh for the night sweats. And they both could be options, but of course I would want to check to be sure it didn't interact with any other medical conditions she had or medication she was taking.
I've just taken my first dose of Boniva with water. Must I now wait an entire hour before having anything whatsoever to drink other than water?
You are correct. That
Okay.
is the proper way to administer Boniva. You should take it on an empty stomach. Usually most people do it first thing in the morning. You need to sit upright and then have that glass of water, take it with a full glass of water, and stay upright for about an hour. That is appropriate. And basically it's the proper way to administer it because that's how it was tested. And it also helps to prevent against some adverse effects like maybe some acid reflux or kind of heartburn symptoms people may have had in the past.
How long does Fosamax stay in your bones?
Fosamax is another one of the prescription medications for osteoporosis, and it does have a very long half-life, meaning it can stay around in your body for a good long time. In fact, many years, even up to 5 years or more.
Wow.
So it is a medication that kind of hangs around for a while. And I think we're still trying to determine what the appropriate time is that someone may need to restart medications if they stop them. But generally speaking, it is a medication that will hang out in your body for a while, and that's good. It'll help to stay in your bones and keep them healthy.
Can birth control pills cause high blood pressure?
Birth control pills do not per se cause high blood pressure, but they could worsen high blood pressure. So if someone's blood pressure is very high, usually in the range of having it over 160 millimeters per mercury, that would be for the systolic blood pressure number, we would not encourage someone to start oral contraceptives.
I'm on Depo-Provera and just underwent a breast augmentation for which I was prescribed a Z-Pak. Should there be any problem with the effectiveness of the Depo-Provera with this antibiotic?
There are not any interactions between Depo-Provera and the Z-Pak, which is also known as azithromycin. It is completely safe to take both of those together, and she shouldn't have any problems with the efficacy of her contraceptive when taking this antibiotic.
Okay, well, what about any type of birth control and antibiotics? Are there any interactions that we should be concerned about?
Yes, there are. So there can be a problem with taking other types of oral contraceptives when we take as a pill and antibiotics. And so there are interactions that could decrease the effectiveness of the birth control. So what we would generally encourage is that if you need to be on the antibiotic, which is obviously probably the case to treat that infection, that you use a backup method of birth control. And then an example would be like a condom to make sure that you don't have the chance of becoming pregnant.
Can you take Advil or Advil PM while on Yaz?
It's completely safe to take Advil or Advil PM with that medication. So it'd be completely safe to take Yaz and Advil.